Yeah. I'm working, trying to, keep men healthy here. So,
Dude, I'm so glad we were able to, but we are so behind on our schedule. Like, I don't even know what time we'll make it to LA or if we do make it there.
oh, you'll make it. You'll make it.
Hope.
When there's a will, there's a way.
You see here, I mean, you're probably used to this view. I mean,
Yeah.
so
It's a rough drive there through the Midwest. I see you went through Iowa, where I went to medical school, but you
Yeah.
avoided Nebraska, which is my home state. So come on, next year you got to go through Nebraska. I can hook you up.
Well, you'll come with us next year, so. Dude, that's
Very good.
What is that on your white coat? Is that a? Is that a
Yeah,
ribbon?
we got our blue ribbons. Yeah, we got our blue ribbons for Men's Health Week going on, and we had a nice photo this afternoon that we took, but I don't have a copy of it yet. But I'll be seeing it later.
So, Dr. Jameson is at the Mayo Clinic in Scottsdale, correct? Or is it Phoenix?
Well, the hospital and our offices are Phoenix, so now we call it Mayo Clinic, Arizona, and I'm on the Phoenix campus. But it used to be known as Mayo Clinic Scottsdale, but now we call it Mayo Clinic, Arizona, and there's a Phoenix campus and a Scottsdale campus.
So what's very unique about Mayo Clinic, Arizona, and what Dr. Jameson is doing is they run a men's health clinic. And we actually talked about this with a few other people, but I think you guys have it down pat. I mean, you guys have been working on this for a while, and I think you're the first in the entire region. Talk about this clinic.
Yeah. Our connections are a little loose, but I think you're. I'll tell you a little bit about our program, and it's taken a while to set this program up, but we have it sort of up and running just for the past about 6 months. And I'm maybe gonna check and see if you're still hearing me. You're kind of frozen.
Oh, there you go. Can you hear me?
Yeah.
Okay, I don't know what happened, but go ahead. Sorry, man. We didn't hear anything you said. I think it's my internet, so sorry about that.
Yeah, no problem. That's what I was trying to figure out. When you freeze, that means that you probably can't hear me, but I kind of figured that out. Yeah, so we've had our program about 6 months. It took about a couple of years to get people coordinated, to get it streamlined at a institution like Mayo Clinic, and it really sort of developed between urology and cardiology and endocrinology. We're sort of the main players that are part of our program. And so we've set up a program where if a man wants to just get an evaluation of their current health, they're able to call in based on some of their questions. They may have certain pre-testing completed, and then they all have a visit with myself, and they all meet with cardiology as well as with exercise physiologist and a dietitian to give them sort of individualized treatment plans. And so we want to try and make it easy for men to come in one place and get a lot of these things addressed. And really we feel we can just we want men to get the truth about men's health. We want them to come, we can just give them a very non-biased opinion about certain treatment options, what we really feel is in their best interest. And so we think it's a real good opportunity for men in the Valley here to come in for a comprehensive evaluation.
So tell me, how does it work? Like if I were to come into your office today and you find that I have a heart condition, I mean, can I see a heart doctor today? Or is it just, I just don't, like how is it comprehensive? Is it just they get everything done at the same time? Or is it just just go to one place like Walmart?
Well, it's. I would say that we try and coordinate it as best as we can.
Okay.
If someone were to call in this program ahead of time, we can try and coordinate these visits in one day. But sometimes, depending on the amount of testing that's required based on the answers that they give on their screen, it may the logistics have to be sorted out because one is the logistics because our Scottsdale campus is where the cardiology visits are, and then the Phoenix campus is here. So it's about 30-minute drive. So sometimes we can do it all in one day. But now, as far as just adding it on that same day, that's not as easy to do. So we really try and screen. There's a screening process. So ahead of time, we have these appointments set up.
Oh.
We'll meet with the cardiologist no matter what. Everyone that comes to the program will have an assessment from the cardiologist and the urologist.
Oh, that's cool.
The endocrinologist will just depend on their questions and if they have diabetes or a history. So everyone is meeting with cardiology and myself and urology who calls in. So it's actually a pretty cool program. I went through the heart health part. So the heart health program here at Mayo Clinic is integrated into our men's health clinic. And so I actually went through the heart health program myself a few months ago. And you think we're doctors and we have a good idea and we're men's health experts, but literally going through this program, especially with regards to meeting with our exercise physiologist, who is a great guy, has done a lot of research on exercise physiology and aspects of lifestyle changes and how they can interview people to motivate them with certain follow-up techniques and things that I wasn't aware of. Particularly for my own health, I have very poor flexibility. And so all the testing that you did for me, I was in the very low percentiles. So as we get older, we have to be able to maintain our flexibility to remain independent. And so this is even an area that I'm now focusing more on, through either regular stretching exercises. Some people will use yoga. But I think that we don't realize our bodies will become more stiff, and the older we get, the more help we're going to need to remain independent and agile.
So are you stretching more now that you discovered all this stuff?
I'm trying. You do well for the first few months, just like any patient. You do well, and then things travel off, and then you have weeks like this that get even me motivated about my own health.
Yeah.
So I can tell you this week I've done my workouts every day. I'm doing well this week. So it's good just to have, these events so that we can make habits that aren't just this week. Obviously, it needs to be more than just this week. I know one of your posts say this isn't just Men's Health Month and week. It really needs to be a constant year-round.
I was part of a tweet chat today with Everyday Health. Wow, you actually read my tweets. That's awesome.
Oh, yeah. No, I've been reading. I've been trying to get on. I've been reading your tweets, and I've seen some of the videos. I love some of the karaoke moments that are occurring. So I've seen some real talent, I think.
Oh, man. So tell me, you yourself are a physician, and you've had some difficulties getting motivated. So what can we do as physicians and males to motivate men to take better care of themselves?
Well, this whole week is just about awareness. Just having men even just think about their health, things that they may do that may influence their health is important. I wanted to tell you about a patient who I just saw this past week. I don't want to try to change the subject, but this is just an example about, this is really serious for a lot of men. I had a patient who was 65, very healthy and very active. He was running 10 miles 3 times a week, participates in competitions. This guy was the epitome of what looks like health. And he started to have some urination issues that eventually just prompted him to finally see a physician that he hadn't seen a physician in years. And they ended up getting a PSA test, and it was 300.
Wow.
So he came to me, and I examined him, and his prostate was firm, very suspicious for prostate cancer. And we did a biopsy, and he has very aggressive prostate cancer. I've talked with this gentleman a lot because this was obviously such a big event for him because he's been so healthy, no other medical problems. And I wanted to just understand where he was coming from about this. And he's like, Dr. Jameson, I am so healthy. I never had any medical problems. I really felt invincible. I never would see doctors because I just was in such good shape compared to my friends. And so and so he kind of learned about how sometimes even when you feel great, some things can happen. And so I asked him, well, what would you recommend to people, other men, if you were age 50 or younger? And he's like, I definitely think men need to see the doctors no matter what, even if they are healthy, feel healthy, and even if they are very active. Things like this just happen. And so just an awareness. This was a smart professional man who's very active that just got burned by not seeing the doctor. So it really this is actually quite serious for potentially for a lot of men. I mean, it's obviously seriously for everyone, but this was just one example that really hit home to me that just occurred last week. So getting an awareness of men to just think about their health, that they may be able to be healthy even if they feel like they're doing a good job. At least come in and discuss with your doctor what the options are with regards to certain preventative options. Communication is where we have to just keep talking to men.
Well, on the Twitter chat today, there was some good points about communication and how couples that communicate do better. It doesn't have both. It can be friends or bros or sisters or whatever it is. Communicate about your health, and I think that is very important. I agree with you that that guy would have probably gotten saved if he got his corporate screening. But when is the right time to start screening? Is it 50? Is it 40? Is it 30?
Well, it's a very loaded question. You'll get a lot of variable opinions. I personally sort of follow the NCCN guidelines, which recommend a baseline PSA at age 45. And then depending on what that level, if it's less than 0.7, then you can then wait until age 50 to then check it again. I mean, it really, we're learning more that baseline PSAs in the 40s and early 50s can be predictive of troubles down the road. So we may not need to screen everyone every year for their entire lives. We need to do it more in an efficient, a meaningful way. So I really believe that the younger men are the ones that really can benefit to figuring out who needs to be watched closely or who doesn't need to be watched. So that's a strategy that I take, is really what is recommended by the NCCN guidelines. And then starting at age 50, depending on what their levels were before, I think each patient, you have to have a conversation and individualize what was their PSA, where are the trends. It's not the greatest test, but I'm not ready to go back to how it was before PSA, where the majority of men presented with metastatic disease.
Cool. Well, so you mentioned PSA screening. Now, what about just screening overall, like men in general? What we usually tell people, you should go at least once a year. It doesn't matter what age you are. If you're 20, 30, 40, 50, at least go see a healthcare professional once a year. They will talk to you. They'll assess your risk factors, and then they will decide whether, great, nothing to do, or if you need lab work, or if you need to do examinations. Like, going once a year to a physician, young men may learn about testicular exams, doing them once a month, and then preventing testicular cancer. If there's a really significant cardiac history, then they may see that, this guy has high cholesterol. We had a young guy who's 25 years old who's on the team with us, who got his blood checked after the drive last year, and his cholesterol was up the roof, out of super normal range. And so now he's changed his diet. He's actually on medication. And he's like in his 20s. I mean, he would have never discovered it if he hadn't gone and seen a physician. So I think it doesn't matter how old you are, how young you are, you should go see a physician. Wouldn't you agree?
I definitely agree with that. I mean, certainly the AUA has a men's health checklist that's on the AUA website, and if you look at that, it even starting at age I think 18, recommending regular visits. Now they're with regards to blood tests. If you have risk factors for cardiovascular disease or lipids in your family, then certainly getting blood draw at age 20, and then maybe every 5 years if it's normal. Then everyone starting at age 35. So now these AUA guidelines were sort of developed based on a lot of other, guidelines, whether it's family practice or cardiology. They sort of coordinated them all into an AUA men's health checklist that is available online, and so I think that's important. The reason why I think it's good to talk to young men regularly is if you look at why men young die before the age of 50, it's usually more related to these risk-taking behaviors and traumas and risky behavior and whether it's suicide. I mean, all these mental health issues often are starting at men in these age. So if you're meeting with a patient regularly, as doctors, we can hopefully pick up on some of these issues.
Absolutely.
And get them earlier. So we can't just wait till age 50 to start checking prostates. We do need to be meeting regularly with these younger people, because it's really the patterns that they probably established in their 20s and 30s that would be beneficial late in life. Imagine if we can just get men in their 20s and 30s to realize how diet and exercise can help prevent erectile dysfunction, how if we get their patterns set at an earlier age, we won't have as much work to do at age 50 when they sometimes do get to our clinic when they have a urination problem.
And I agree with you. I mean, I would much rather have no work than a lot of work. If the whole world could be healthy, then we could all just chill out on the beach and just enjoy life, right? But obviously that's not going to happen. But that is something that we could hope and pray for. Now, you mentioned prevention. Now I have Dr. Rogers on the line. Dr. Rogers, can you hear me?
I can hear you, Bob.
Dr. Rogers in Los Angeles, correct?
Yes.
And what is your specialty, sir?
I'm a podiatrist and I specialize in preventing amputations in diabetes.
Yes, so, diabetic, so, I mean, you mentioned erectile dysfunction, Dr. Jameson. Erectile dysfunction is directly linked with diabetes, directly linked with high blood pressure. And in Dr. Rogers' case, it's directly linked with amputations. I mean, I think men can live without erections. I mean, at least I think so. But living without your feet and your toes can be very horrible. So, what we're trying to get men to realize is it's not just your prostate, it's your entire body. It's kind of like a car. Your car is not just the engine. There's the wheels, and then there's the paint, and then there's the handlebars. There's so much to a car. So you got to think outside and globally. And I'm glad that we have men's health centers like yourselves at the Mayo Clinic to get men and the overall community to think more globally. So that's awesome, Dr. Jameson. Any parting words for us, Dr. Jameson?
Well, no, obviously I think, your event last year, and it's grown even more this year. I'm really enjoying watching it evolve, on social media. So I know this has been a lot of work, and I want to really congratulate you guys and just, thank you for what you guys are doing. It's good for urology, but it's good for men's health. But it's just a good-natured thing that you're doing to bring out more awareness to these issues, because I want to try and help men like the patient that we had this past week. We need to try and catch these men sooner.
I agree, man. I agree. Well, thank you so much. You can stick around if you want, or we can catch up later. But sorry we couldn't make it to your city. We're so behind on our schedule, but we look forward to hopefully stopping next year.
Yeah, sounds good, Jamin. Keep in touch.
Bye, buddy. See you, man. Thank you.
Bye-bye.
In Cleveland, Ohio, and we're about to start our program here actually inside the Glickman Institute. We're actually going to take the car, the Tesla, and roll it through those windows and inside the lobby. We're very excited. We have all the our local drivers, which are the urology department, actually the whole institution.